Thank you, Director Xu, for your sharing. Now it's already noon. You're still very passionate. Now let's proceed to the next session. Professor Liu Yujuan has some time conflicts, so we need to switch the sequence. Let Professor Liu Yujuan to talk first. Liu Yujuan is from affiliated hospital of North Sichuan Medical College. Associated Professor, affiliated Hospital of North Sichuan Medical College, and member of a Gynecological Oncology Committee, Sichuan Anti-Cancer Association. She has many titles. I'm not going to read them one by one. Professor Liu is going to share with us insights into treatment of cervical lesion related to high-risk and HPV infection. It's different from a previous content. So let's welcome Professor Liu. Thank you for your kind introduction, and thank you, Director Zhang, Director Anming, for your kind introduction. This morning, we have talked about a uterine fibroids and adenomyosis. Well, as for my part, I would like to help you to get relaxed and share it from another perspective about the small HIFU, the applications in the cervical diseases. Well, because the big HIFU is like the first defense lines, while cervix is like a door of our house. HIFU surgery. Sometimes after surgery, we found there are severe cervix diseases or even cervical carcinoma. So, as a clinician, you will see some of the diseases regarding cervix. As women, we all have such issues. So, as we know, a high risk is caused by HPV. We're really worried about an HPV infection. I would like to share from the following aspects with you. So, high-risk HPV infection for women would get infected to some extent. However, in majority cases, it will be cleared. Well, before the cervical cancer takes place, there's a epithelial change. So high HPV may lead to vulvar, vaginal, anal cancers, and it also brings burdens to their families. They will also have a feeling of guilty, since many are sexually transmitted, and as we know, the main reasons of cervical cancer is an HPV infection and disease progression. For high-risk HPV, what are the current clinical management? I have summarized here. For physicians and for patients, it's really very tough. So once there's some persistent infections, it's difficult to turn negative. Should we have radical resections or even we had a resection, HPV infection may still persist and maintained positive. What if after resection there are residue lesions what can we do about it? So typically, CSCCP, the large meeting of these areas, has reported and discussed about the treatment for high-risk and HPV infections for female. The core perspectives is that currently no specific antivirus drugs exist for HPV. Treatment goal is to eliminate lesion rather than the virus itself. As for no-cell, most guidelines recommend follow-up observations with diagnostic colonization or ablation performed in same cases. And there are some ablations performed as well. So drugs are not recommended as a regular treatment approaches. But what can we do about it? And we cannot just wait for it to progress. So there are two therapies, exceptional therapy and physical therapy. Well, CKC is a typical a classic treatment and physical therapy. We have studied HIFU and also PDT, electrical regulations, and cryotherapy. Now let's have a look at the cervical colonization, CKC. Shortened cervix with petaroid appearance after CKC, and also post-leaves cervical stenosis, and it's difficult to have a re-examination for those patients who wants to have children bearings, and this it's about 3 centimeters, but we need to dissect or resect 1 to 2 centimeters. How much would be left, and there are many risks related. Currently, there are 2 major opinions. First, majority would think since it will turn negative, we can wait and watch, but that means to misdiagnosis or missed cases. And secondly, they are treated actively. However, that may lead to waste of resources and unintended cervical damage. Therefore, doctors of this department are thinking about simple, effective, and minimal invasive approaches which can effectively shorten the clearance time of HPV, simultaneously treat a cell, and for fertile women, we need to consider how to preserve the integrity of cervical tissues and function. There are different guidelines. There are no-cell guidelines and high-grade guidelines. Experts at home and abroad are exploring constantly. For no-cell, you can choose wait and watch or ablation, and for persistent infections, you can choose colonization. And of course, we need to tell the differences between those who wants to have babies and those who don't. Well, sometimes women choose to wait and watch because they want to have baby, but that can be scaring. Well, in CNR conference this year, there was a half-day session talking about those risks. Experts gave a lot of opinions to help those women to preserve their cervix. So many doctors chose ablation therapy, that is a physical therapy, but it has a defect, that is it's lacking of a sample. Whether dissection has been or treatment has been complete and closely follow-up and is needed. So how can we choose? As we know, lasers and infrared light, and these would have less penetrations in cervix. Today, we're talking about focused ultrasound, and it can work on 3 to 6 millimeter underneath of the skin. So averagely it's about 3.4 millimeter. If lesions is exposed, then energies can reach 3 to 6 centimeters, and high grade lesions can be treated with such a way. And focused ultrasound treatment can help to reduce the inflammations and help the elasticities and of service to be recovered. So these are the actual performance, actual operation. You see the treatment can be finished in less than a minute or maximum 10 minutes, and then no bleedings and no wounds at the cervix.
When we're doing the laser ablation, we can see the smokings and the sparkles are where we need to just wear the mask, and also there are the oil beads on our faces of the surgeons. This is the great damage to the patient as well. So for the continuous inflammation combining the aerosol, and our consensus is like this. During the surgery, we will follow the instruction, the guidelines by the doctors to just tap into and explore the more approaches for the aerosol. The key point is to just do the follow-up, and during the follow-up, the patients could easily get anxious, and the patients will ask the doctor whether 1 or 2 years after the operation, the disease will be gone, right? And so for the cervix, the research, our clinical research on the cervix started from the 2006, and since 2017 we started to help the HPV patients with the low cell, and we can see that by just using this approach, the elasticity of the cervix has not been influenced. Our doctors has just known more about this disease, and 6 months and 1 year or 1 year after the operation, the cervix will return. We will do the follow-up examination, and the effect is very good. So from 2017 to 2019, our hospitals started to use the FUAS to cure the cervix, the cervical lesions, and we found that the ultrasonic, the focused ultrasound, the surgery is shorter and more effective, and from 2011. We use the FUAS to just we just compared FUAS and the other traditional approach. We found that during the follow-up period, we can see that the FUAS has a shorter period of the operation, shorter than the laser ablation, and better than laser ablation. And here also about the mechanism, we can see that after the FUAS, we can just change the microbiota of the vagina, and microbiota is a very hot topic. Everyone wants to just take the more perspective to help the patient to get rid of the HPV, and we found this the HPV after the FUAS. The FUAS could help the cervix to improve its the immunity ability, and FUAS could not only just utilize the cavitation effect and the thermal effect to just to cure the lesion, but also improve the blood circulation. So the use the FUAS to cure the highly dangerous, highly serious the HPV patient now this has become more and more popular, and now the domestic and the foreign guidelines also pays attention to the females with the requirement of pregnancy, and for the foreign guidelines, it is either the simple simple treatment or the follow-up. So for us, we need to just preserve the cervix and the conceiving ability. And in 2019, a female patient just came to find me in 2019. And she was 20 years old, and this a female just refused and she refused. She refused the vertebral incision, and due to the experience of the ultrasound ablation for more than 10 years, according to our observation of this disease and our understanding about the medical guidelines, so we just communicated with the patient and recommended the FUAS, and in short term it will not just incur the pains. And after the approval of the patient, and 3 months after the FUAS operation, we did the cervix and the vaginal examination, and we can see it is good and very still elastic. And for in the next 2 years, for more females who wants to just preserve their fertility, and we just did the FUAS, and we followed up all the patients, and only one patient missed the follow-ups. And in the first block, 29 cases of the patients within 1 year after the operation, 70% of the patients turned negative, and the 90% of the patients didn't just have the recurrence. Back then we dare not to just deliver this report. Somebody will just say that the data is not real. The result is not true, but finally we can see that the result is true, and we're confident because every patient is followed up by me. Every patient was taken care of by me. So the data is absolutely real, and so we just carried out a long-term follow-up visit. And why the success rate is so high? Because we did analysis. The first reason is that the patients are too young, and the second, all the lesions are external lesions, and the third, we were a little bit panicked. We also just combined the HIFU and other medications. So because we need to be responsible for the patients, and later our teams in the hospital did some research about this. And we compared this solution with the vertebral incision. We can see that the efficacy is the same, and also with short period of time, the negativity ratio of the HPV 1 year after the operation are the same, and nearly no complications, no bleeding, no pains, and no need to anesthetize. So it's a very good choice for the patients. And also, we just carried out some research about the post-op fertility. After the HIFU treatment, comparing to the patients who has not received the cervical treatment, the fertilization ratio and the proportion of the pregnancy is the same. So we also just carried out the monitoring of elasticity of the cervix, and also we carried out the examination of the microbiota in the vagina, and also carried out the blood supply comparison before and after the HIFU, and the result is good. We hope that the HIFU could just benefit more patients, and for more the HPV patients, if the patients turned positive after the operation, how should we deal with it? There are guidelines, but the guideline is not just It's not simply about the incision, and some doctors will just do the vertebral incision for the second time or for the third times. But these doctors are very confident. This kind of confident and highly capable doctors are rarely seen. And actually, HPV positive patients, for those patients, we do not just recommend the simple incision. And if the patient who has experienced the one round of the surgery, then they will get panic. If they don't know whether or not, they will just go for the second round of the upper surgery. And in this case, the kid is the 24 years old. He has did the vertebral incision twice, and then the lesion has gone external. And should we just go for the external vertebral incision for the third time? So in front of pressure, we just recommended her to undertake the ultrasound, the ablation. We can see the cervical lesion is very small, and the cervical lesion is not big enough to just block or just harm the rectum or the bladder. So we just did the HIFU on this little girl, and the post-op, the outcome is good. This another case is the patient with 40 years old, married twice, and she has the requirement for the pregnancy, and for 40 years old, the girl, the uterus function is decreasing, and if the patients would like to just conceive after the large-scale surgery, then the pregnancy probability is very low. So we just try to just recommended her the HIFU and the HPV and all the parameters 6 months after the operation turned normal. And some of the doctors found that for the laser or the ultrasound, the ablation or the vertebral incision, if the energy is not distributed evenly, then it will cause the tissue hyperplasia and also cause the bleeding. And although we told the patient that the vagina will just bleed, so they will just cast a shadow in their heart. And although there's no cancer, but this will cause the panic for the patient. So we just tried to just carry out the HIFU for the patient, and we just ablated the lesion. This lesion is deep inside, so we cannot just ablate all the lesion. But the effect is far better. So for the in conclusion, the HIFU is better than it's better in terms of the efficacy, especially it is used for the HPV continuous inflammation and the cervical LSIL, the operation, and also the HIFU is also hopefully used to just be used as the new treatment for the HPV patient or the cervical HSSL patient with a requirement for the pregnancy, and also the HIFU could be used to cure other after effect caused by the cervical lesion, which is caused by the other physical treatment. So I'd like to suggest that we can just have more research about HIFU and preserve more the pregnancy functions and benefit more female patients. Thank you, Madam Liu.